Madhu Vulimiri.
Hi, everyone. Good afternoon. I'm Madhu Vulimiri. It's such an honor to be with y'all. This is my first time at the Child Hunger Leaders Conference, and I'm incredibly blown away at the energy and passion in this room. Really excited to be here to share a little bit more about what we're doing at the state level in the nutrition and hunger world, and just want to express gratitude for the work that each and every one of you does every day to make sure that no child is going hungry. So I'm Madhu Vulimiri. I'm the Deputy Director of the Division of Child and Family Wellbeing at the North Carolina Department of Health and Human Services. And in that role, I oversee 3 major nutrition benefit programs, which are SNAP, which is also known as Food and Nutrition Services in North Carolina, the WIC program, which stands for Women, Infants, and Children, and also the program that you got to hear about just now, which was CACFP, Child and Adult Care Food Program, which is the umbrella program over the After School At-Risk Meals Program. So excited to share more about what our division, as well as some of our partners, not only at the department, but outside of DHHS, are doing to really help continue to make sure that all children and families can thrive and have the food they need to do that. So on the next slide, I want to start by just sharing a little bit about some of our priorities at the Department of Health and Human Services. At a really high level, we are doing work that is trying to advance behavioral health and resilience. We know that our kids are struggling with mental health issues that are on the rise. We're also working towards overall child and family well-being, and finally, working towards efforts that are going to increase and improve our workforce. And I think it's very clear to me that nutrition and food is a cross-cutting issue that supports all of these. I think folks have said it many times today. We know when our kids are hungry that they're not going to do as well in school, that they need those supports to be resilient, and for their families to also be resilient and thriving. So in the spirit of Game On, I'm going to do a lightning round so that you can get a little taste of the many things that we're doing at the department to really address hunger and promote nutrition and food security. So on the next slide, I think if any of you are adjacent to the early childhood world, you probably heard about the Early Childhood Action Plan at some point before the pandemic. This was a really big initiative that we worked on really across the state to lay out our goals and our vision for North Carolina's kids. And one of those goals was around hunger and nutrition and really trying to decrease the food insecurity rate among our kids. And seeing in 2025, we want to see that go down from 20.9% to 17.5%. So we still have a lot of work to do to keep getting that number lower and lower. So on the next slide, I want to tell you a little bit about some of the work we're doing to keep moving the needle there. So first, one of our big strategies is trying to increase the reach of benefit programs. We know that programs like SNAP, WIC, CACFP, and the ARAM program, these are evidence-based programs that we know make a difference in improving kids and families' economic outcomes, their health outcomes, their social emotional well-being. So we're trying to reach more families who are eligible but may not know it and are likely not enrolled. So one of the things we're trying to do is match our own data across folks who might be enrolled in maybe one program between SNAP, WIC, and Medicaid and not in the other, and figure out who are those families and really test different kind of outreach methods like text messages to encourage families to enroll. So really excited about some pilot work in that space. We're also trying to do work around improving the beneficiary experience, making it easier for families to access programs like FNS and WIC through improving technology. We know the pandemic all showed us that it's no longer acceptable for us to expect that people have to come in person to a county local health department or Department of Social Services to get the benefits they need. We need to make our services more accessible online, and so there's a lot of work we're doing across both of those programs to make that possible. And then you got to hear from Roanne Salisbury and the Second Harvest Food Bank about their work in ARAM. We have 47 institutions currently that are participating in the After School At-Risk Meals program. 21 of those are school food authorities, which we are incredibly excited about. And yes, applause. And we want more. We want to see that number go up. And so really want to shout out the previous speakers and hope that you got to see that testimonial about how powerful this program is. And if you want to learn more, please feel free to talk to me, but you can also reach out to our team at cacfptraining@dhhs.nc.gov. But feel free to flag me, and I am happy to talk more afterwards. But we want to grow that program more and reach more kids through the CACFP program. On the next slide, we are also doing a lot of work to connect healthcare and food support. So I think we all are well aware that having access to healthy food means that people are more likely to be healthy. It's a no-brainer. There's now increasing language about food as medicine. I think things that all of you have known for a really long time. So one of the things in our Medicaid program, which is health insurance that provides care for 1 in 5 North Carolinians, is we are implementing the Healthy Opportunities Pilot, which is the first program of its kind in the country that is using Medicaid dollars to pay for things like medically tailored meals or food boxes. So we have 3 pilot regions across the state and are really, really excited about there's a lot of money in healthcare, y'all, and we gotta tap into it to use what we can for nutrition. So really excited for North Carolina to be on the cutting edge of using our healthcare power to pay for food, because we know that's critically needed. We're also trying to grow NC Care 360. If you haven't heard about it, it is one of the first statewide coordinated care networks, which means that if your organization is enrolled, if you have a family who comes to you and says, I'm hungry, I need something to eat, it's a tool that you can refer that family to, let's say, the nearest food bank or to their county DSS agency or their WIC agency, and get a closed loop referral to know whether they actually went or not, because we know that's often a challenge for organizations that are trying to help families. Well, did my efforts even help? And so encourage folks, especially our community-based organizations in the room, if you're not already part of that we'd love to have more people in that network to connect people. And then finally, our Medicaid program has a really big reach. As I said, 1 in 5 North Carolinians have Medicaid as their health insurance. And so an initiative that we have is to screen every single person who is enrolled in Medicaid for nutrition security. And if they are not scoring well on that, if they have needs that they've expressed, making sure they get connected to SNAP, WIC, or other supports in their area. On the next slide, a third major strategy we have is around breastfeeding, which we know is incredibly important for early childhood nutrition. And a couple of areas we're working on is among our WIC staff. Several thousand WIC staff across the state, we are having them all get trained in breastfeeding training to support families, especially, as y'all know, the infant formula shortage that has been happening since last year, and it's not over, unfortunately. In some cases, we know not everybody can breastfeed, but when there is the opportunity to, making sure folks have the resources to do that. And then finally, trying to implement a statewide breastfeeding hotline so that any family who has questions about how do I do this, any mom can get the support they need. So those are some of the major initiatives happening. And it's a lot, but there's more that we still need to do together, and I'm really excited to be part of this community. I want to share a little bit more that we're doing in partnership. So on the next slide, I'm looking at Lynn Harvey, who is one of the people who I most respect and admire as a colleague, who I've learned so much from. And I'm so grateful for the partnership that DHHS has had with the Department of Public Instruction. We've been able to do some amazing things long before the pandemic, but even more during the pandemic. And some of those things I hope that you're familiar with, like the pandemic EBT program, which would not be possible without our collaboration and commitment. We've been able to issue over $2.3 billion since 2020 to over 1.5 million students. That is huge. in terms of when kids were not able to access meals in school. So we're really, really proud of that program, which we're working with DPI to do again for this school year. We also have some work that we do direct certification with the Medicaid and FNS program and National School Lunch. And then finally, I know this is not directly related to nutrition, but it is, because mental health is connected to food, is connected to overall health. And so we are working with over 1,500 schools, K-12 public schools in over 70 counties, to expand mental health resources for staff, students, and families. So just to give you an example, one of the initiatives is over 130 of these schools are going to have access to child psychiatry consultation to support their staff who often don't have those kinds of resources when they need to support kids who are having increased behavioral health issues or needs and support. So really, really excited about that. Next slide. So I want to just touch on some changes that are coming to the federal and state government benefits landscape that really will impact many, many of the families that we serve, but that you all serve as well. And one of those is that in the SNAP program in FNS, all 900,000 households, or 1.6 million people in that program, have been getting what are called emergency allotments, extra benefits, since the beginning of the pandemic. At minimum $95, but for some families, hundreds of dollars a month in extra benefits. Due to a change at the federal level, that program is ending. And so this is actually the last month that we're going to be able to issue those benefits. So we're really worried. You know, I think people have been talking about a hunger cliff, and it's here. So next month, unfortunately, we would have kept going if we had the federal authority to do so. But next month is when all of our families in the SNAP program are going to see a decrease in the benefits that they receive. And so we do anticipate the need is still there. People still need help. It hasn't gone away. The pandemic is better, but it's not over. And we know that families still need assistance. So this is going to be a really pivotal time. The other big thing that's coming is that the federal public health emergency is coming to an end. And that has been tied to a lot of different waivers in the Medicaid program, WIC, FNS. And so it'll mean changes to what our participants are experiencing. And so what are we doing about all this? We're trying to promote the food resources that we do have. You've heard about a number of them today, but also have a central website that you see with the short link above, as well as the WIC program and NC 211. So I'm going to end with a few calls to action, because I know it's really hard to hear this news about the hunger cliff that's coming and not feel helpless and powerless of what can I do to support families. So I want to lay out a few things that you can do, how you can get involved. Feel free to take pictures of this. We are hosting a Food and Nutrition Security Summit at the beginning of March, on March 2nd and 3rd, where we're really trying to bring together a diverse array of stakeholders that are involved in any sector that relates to food and making food available. So the QR codes are the 2 registration links. We would love to have all of you join. A big part of the summit, it will be virtual to try to increase the number of people who can participate, is to have people connect with others in their region so that they can really strategize about solutions to help families, especially as we have this looming kind of hunger cliff. The second I would say is promote our website, dhhs.gov/food resources, which has a lot of other programs on it. I think you've heard today our food banks are going to need support. They're going to need all of our support as more families are going to be reaching out to them as their benefits decrease. So offering support to them. If you're representing a school food authority, we would love for you to get involved with the After School At-Risk Meals program. So again, if you have any questions about that, please flag me or we can get in touch. And then finally, CBOs, I mentioned, to join the NC Care 360 network so that people, when they're referring folks who might need services, can refer to you, or you can be someone who makes referrals. And then I have one more slide, a little bit about the WIC program. So WIC serves over 250,000 women, infants, and children. We have a lot of materials we'd love for y'all to share. It serves children under 5, so probably more relevant for a younger child audience, but we have materials that can be ordered online and an online referral form that you can, it's very straightforward, less than a minute to fill it out. If folks think they might be eligible, they can fill it out and a WIC agency will contact them in about 2 weeks and screen them and see if they're eligible and have that conversation. And then you can sign up to receive our WIC quarterly outreach newsletter. The email for who to contact is on the page. And then final call to action, again in that mental health space, let your school administrators know that you hope that your school will be one of the schools that is offering youth mental health first aid training, so that we all, as school partners and community partners who work with young people, can really support them as best as possible, regardless of what they're going through in life. So with that, that was a lightning round, a lot of information, but thank you so much for all the work that you all are doing. It is incredible to be in this room and to get to hear your stories and the impact that you make on a daily basis. I'm really eager to get to partner with, we already do, DHHS already does partner with many of y'all, but we are eager to partner more to the extent we can. So thank you so much.